coma is one of the most mysterious and perplexing states of consciousness. It's often depicted in movies and books as a seemingly endless sleep, but in reality, the physiological and neurological process occurring during a coma are far more complex than most people realize. For individuals who find themselves in a coma, their body may remain in a state of suspended animation, but inside, various intricate biological functions continue to unfold. In this article, we will dive deep into what happens to the body and mind when a person enters a coma. We will explore the causes, the effects on the body, the mysteries surrounding the brain, and what science has learned about this enigmatic state. What is a coma? Before delving into the intricacies of what happens during a coma, it is essential to define what a coma is. A coma is a deep state of unconsciousness in which a person is unresponsive to external stimuli, such as light, sound, or physical touch. Unlike sleep, where the body undergoes cycles of consciousness and unconsciousness, a person in a coma does not show any signs of awareness or purposeful movement. Comas typically result from severe brain injuries, whether from trauma, stroke, infections, or other medical conditions. They can vary in length and severity. Some individuals may recover fully from a coma, while others may remain in a vegetative state or experience irreversible brain damage. The causes of coma. A coma can be triggered by several factors. These include head injury. Trauma to the head, such as from a car accident or fall, can lead to brain swelling, bleeding, or bruising, which disrupts normal brain function. Stroke. A stroke occurs when the blood supply to part of the brain is interrupted, causing brain cells to die. This can lead to a coma if the affected area controls consciousness. Infections. Certain infections such as meningitis, inflammation of the brain's lining, or encephalitis, brain inflammation, can cause widespread brain damage, leading to a coma. Brain tumors. A growing tumor in the brain can exert pressure on critical areas, causing unconsciousness or even a coma. Metabolic imbalances. Severe imbalances in the body's metabolism, such as diabetic ketoacidosis or liver failure, can impair brain function, potentially resulting in a coma. Drug overdose or intoxication. Taking excessive amounts of drugs, alcohol, or toxins can depress the brain's activity, leading to a comatose state. Severe hypoxia. A lack of oxygen in the brain due to drowning, suffocation, or heart failure can also trigger a coma. What happens to the body during a coma? When someone enters a coma, their body undergoes several physiological changes. These changes are often related to the brain's inability to send signals to various body systems. 1. Vital functions. Though a person in a coma may appear unresponsive, their body is still functioning at a basic level. Brainstem, which controls vital functions like breathing, heart rate, and blood pressure, often remains active. People in a coma typically continue to breathe on their own. However, in some cases, mechanical ventilation may be required if the brainstem is compromised. If the brainstem is severely damaged, breathing may become irregular or cease entirely. Heart rate and blood pressure. Autonomic nervous system, which regulates heart rate and blood pressure, continues to function, though fluctuations may occur depending on the severity of the brain injury. Digestive and urinary systems. The digestive system usually continues to function, though the person in a coma may require a feeding tube to provide nutrition. The kidneys continue to filter waste products, but a catheter may be used for urination. Temperature regulation. People in a coma often struggle with regulating body temperature. If the brain's hypothalamus, which controls temperature, is affected, the person may experience fever, hypothermia, or fluctuating temperatures. 2. Muscle and skeletal effects. Muscles begin to weaken from lack of movement, a condition known as atrophy. Over time, immobility can cause joint stiffness, muscle spasms, and even bed sores, especially if the person is bedridden for extended periods. Despite this, reflexes may still be present and certain movements may occur involuntarily due to brainstem activity. 3. The immune system. When a person is in a coma, the immune system's efficiency can decline. This makes the person more vulnerable to infections, particularly pneumonia or urinary tract infections, since they may be unable to cough or swallow properly. Medical staff typically monitor for signs of infection and take measures to minimize risks, such as using antibiotics. 4. Nutrition and hydration. Since coma patients cannot eat or drink on their own, they rely on feeding tubes for sustenance. Parenteral nutrition, intravenous feeding, is sometimes used if the digestive system isn't functional. A balanced intake of nutrients is essential to prevent malnutrition. which can further impair recovery. What happens to the mind during a coma? While the body remains in a state of suspension, the mind experiences its own set of processes that are still being studied by neuroscientists. The question remains, is the person in a coma completely unconscious, or is there a level of awareness happening beneath the surface? 1. The brain's activity. Even though the brain of a comatose person shows reduced activity, it doesn't mean the brain is completely inactive. Brain scans of people in comas have shown that certain areas of the brain remain responsive to stimuli. For example, the auditory cortex may respond to sounds, and some people in comas have been reported to react to the voices of their loved ones. The level of brain activity depends on the coma's cause and severity. In some cases, individuals may experience periods of partial consciousness, where they show signs of awareness or even respond to commands, though these moments can be brief or inconsistent. 2. Dreaming and hallucinations. There is an ongoing debate as to whether people in a coma experience dreams. While some people in comas report vivid dreams or hallucinations when they wake up, others remember nothing. Some researchers speculate that during deep stages of coma, the brain may enter a sort of dreamlike state, possibly similar to the vivid hallucinations reported by people who are in a near-death experience or have been sedated for medical reasons. 3. Sensory experience. People in a coma may still experience basic sensory inputs, even if they are unable to respond. Research has shown that auditory stimuli, such as familiar voices or music, can trigger faint brain activity. This suggests that the brain's ability to process sensory information might still be functioning to some degree, although it's unclear how conscious the person is of it. 4. Brain recovery and emergence. In some cases, individuals in comas may emerge gradually from the state of unconsciousness, showing signs of awareness over time. This process can take weeks or even months, and it is difficult to predict how long it will take or to what extent the individual will recover. Some people enter a vegetative state, where they show no signs of awareness, while others recover to varying degrees, with some regaining full consciousness. The science of recovery. Can the mind and body heal? Recovery from a coma is a complex and unpredictable process. The degree of recovery largely depends on the cause of the coma, the duration of unconsciousness, and the extent of damage to the brain. Medical professionals use a scale called the Glasgow Coma Scale, GCS, to assess the level of consciousness and responsiveness of a patient in a coma. The scale ranges from 3, deep coma, to 15, fully awake. For some individuals, recovery is slow but steady, with improvements in memory, motor functions, and cognitive abilities. For others, recovery may be limited, with lasting effects such as difficulty speaking, moving, or thinking clearly. Neuroscientists are continually exploring ways to treat and reverse the effects of comas through techniques like neurostimulation, where electrical impulses are used to stimulate brain activity, or through medications that encourage brain cells to repair themselves. Conclusion: the uncertainty of the coma experience. A coma is a deeply enigmatic state where both the body and mind experience profound changes. The person may appear lifeless, but on a biological level, the body's vital systems continue to function in a delicate balance. While the mind's experience is less understood, signs of awareness and sensory processing suggest that the brain remains partially active. Recovery from a coma remains an uncertain journey. Medical advancements are improving the ability to assess, treat, and support coma patients, but much about the state remains a mystery. Families and loved ones of those in a coma, understanding the complexities of this condition, can provide some comfort as they navigate this challenging, often heart-wrenching experience.